Good evening. I would like to thank everyone for joining us in this recording today as we engage in a discussion regarding COVID-19 vaccines and related information. I do not believe any true discussion can be had without some learning, sharing of information, thoughts, ideas, and showing appreciation for someone's position related to the subject matter, meaning everyone will have an opinion regarding COVID-19 and vaccines, and we want to hear it. We encourage it, but we want to be respectful for one another's perspective. What I think, although we have many opinions, there's only one truth, and that's what we're in pursuit of today. So let's take care of some housekeeping items right now, and then let's jump into our discussion. This presentation is being hosted by St. Timothy Missionary Baptist Church of Cleveland, Ohio. I am proud that the body of Christ has thrown their hat in the ring and determined that they want to have the community gain access to relevant and even scientific information. This is a faith-based initiative with underwriting by the Ohio Department of Mental Health and Addiction Services. By way of introduction, I am Jeffrey Sims. I am a psychiatric nurse practitioner specializing in adult psychiatry, and I provide treatment for those who struggle with addiction. I have to my far right Cheryl Billingsley. She is a registered nurse. She served in the past as a physician assistant, and then April Holloway, to my immediate right, she served as a respiratory therapist. She's still serving as that. We are consultants to the Ascension Group. It's an LLC of Cleveland, Ohio. So I believe we've done all the preliminary steps, and they're out of the way. Let's jump into the discussion. So today, the topic: why do we still have vaccine hesitancy in our community? Let me make it more germane. What is the word on the street? What are they saying in our local community about vaccines?
Well, they don't trust the vaccine. They said they made it too quickly. They said we don't want to be guinea pigs. And the most important thing is I believe that they don't trust the medicine because the medicines, have not done well for them in the past. Mm-hmm. Remembering the Tuskegee experiment, right?
Okay, so you're jumping right out of the gate, bringing some hot stuff here. So you're right. In the past, our community has been used in experiments, and that is that's hard for us to kind of let go of. It is history, and it is our history, and it makes us more reluctant to try anything that medicine or science would share with us. Remember, science and medicine, I call them kissing cousins. Science informs medicine, medicine informs science, and our past is our past. We have been experimented on.
Well, people don't trust medicine today either because everyone doesn't get the same quality of care. For example, the African American and Hispanics, they have one of the highest infant mortality rate in any of the civilized countries, and that shouldn't be.
Right. So we're talking about two different things right now. So April, you brought up the past, meaning us having people experiment on us. Right. And then Cheryl, right, you're actually talking about present stuff like care disparity, so that some of our people in our community don't get the same level of care. And that does ring true when I hear that. Let me say this. So past, present, and then your point of the vaccines being made, in haste, so they believe in several months, kind of gives them some type of reluctance with this. Let me tell you my experience. So when I prescribing medications, mainly to my new clients, I find that they're very reluctant to try those medications. They might say to me, "What are you trying to do?" Or, "What's this all about?" And then don't let me get to the part of side effects. And some of the side effects really have some kind of, scary, terms for them. They then say, "Hey, I'm gonna back out of that." So I think about it. I'm part of the African American community. What about my colleagues? What are they experiencing when they're trying to prescribe medications? And certainly when we're talking about the vaccine. So, what are you hearing about the vaccines?
Well, I don't know about your colleagues, but don't forget the myths about the magnets, that the vaccine had some magnetizing properties on it, and then I could stick a key to my head or a spoon on my chest, and it'd stay there. How crazy does that sound?
Well, that's actually sad that came about, that misinformation or disinformation regarding the vaccine. Actually, I saw that, play on a national TV about that. And unfortunately, Cleveland or Ohio was in the eye of the storm. What I'm hearing more so is that they feel that when they're receiving vaccines, they're actually receiving the actual COVID virus in their system. And I would have a lot of reluctance if someone is saying, "Hey, you're going to get live COVID." So that's another piece of disinformation.
And that's true. So how we should approach this is with caution and encouraging them gently so that, they would listen and trust.
Yeah. That actually, I'm glad you said that, because these are the four pillars that or three pillars that I use in my discussion with my clients. When we're starting medications, first, I'm going to be patient because of the mistrust. Mm-hmm. Two, I'm going to provide a level of support with them, saying, "Hey, I understand there's some reticence, you're reluctant." And then three, I'm going to arm them with all the information that they need or that they can digest, because it's important that they have, that information.
Well, because you've had the vaccine, you can be an example as well.
Yeah. Well, so now you just bring four pillars, like, hey, I am a role model. I had it. I survived. I got through it. So, and then the patience, and then that support, and then arming them with information. And since we're there with this part about arming with information, let's talk about the vaccine itself. So here's a fact that the vaccine, the COVID vaccine, when it's given, you're not getting the live COVID. What you are getting is a coding or sequence. It's called an mRNA messenger. It's an mRNA vaccine. It's kind of a new vaccine, not a new process, but a new vaccine type that protects us against infectious disease, the COVID virus. And the mRNA vaccine triggers an immune response inside of us. It triggers antibodies, and it tells our body, "Hey, our cells fight against COVID."
Yeah, like the white blood cells.
Absolutely, just like the white blood cells. It's actually telling us, "Hey, you need to fight against this strange thing that's trying to invade your body." So even giving them all of that information, sometimes they're still reluctant. Sometimes people might say, "Hey, I thank you for that. I thank you for your support. I thank you for your patience, but I'm not taking that anyway." So.
Yeah, but you still want to let them know that the door is never closed. Just because they said no then, it doesn't mean that they're not able to reconsider and come back. Right. And get the treatment.
Right. And that's actually where I think we need to step up as healthcare professionals. So we need to understand that I might introduce something to you, and you might not take it the first time around. You might not take it in 5 minutes, 5 hours, 5 days, 5 months, but leave that door open. That's key. That's critical. So I have something I want to ask, and this might be kind of a loaded question. So hear me out. I'm going to try and do that thing that Oprah does. It's $1 million under your chair if you answer the question. Don't look under your chair though. I'm going to ask how many people had the vaccine at this table, and then even more importantly, so it's not just having the vaccine. What made you take the plunge? What made you move to that other step? You had your questions, you had your concerns, but then what made you move to take the plunge, to take the vaccine?
Well, I know that in my profession, my duties put me at a high risk. So I took that plunge and stepped out on faith and got the vaccine. But I didn't do it until the first set of guinea pigs in the department did it. And then when I seen that they were no worse for having taken it, I said, okay, I can do this.
Well, I guess my response back to that is I'm quite sure, those people probably don't want to be called guinea pigs, but I understand where you're coming from with that. And actually, that is actually how it's being portrayed in our community, But so I had a similar response. I actually asked some colleagues who had taken the vaccine, and I'm like, hey, what happened? And what were the responses and what were the side effects? And, sometimes it's better to just do it and not get information, because these individuals gave me these horror stories. They were like, oh my God, my arm fell off. It was the size of a baseball. And then, the next time they said, hey, I was, incapacitated for 5 days, or I couldn't get out of bed. And it really scared me quite a bit. But after all of that, I still made, the decision that I need to take the vaccine. And after I took the first injection, let me just tell you what I did. I decided to take the vaccine, but I took it on a weekend. Like us in our community, we're workhorses. I said, okay, if I take it on Saturday, I'll be able to go to work on Monday.
Right.
So, I took it on Saturday, and then the first vaccine, and I was fine. It wasn't until the second one, and I got up, and let me say, I didn't have an extra arm grow or an extra ear. I was okay. I did okay with that. So I think that's what happened with me.
Well, my experience was the first dose, I just had a sore arm. And then the second dose, I had that same sore arm, but I had muscle aches, but I didn't realize it until later on in the day when I was doing easy stuff and it was causing me pain to do it. And then I realized that it's a side effect from the vaccine.
So what you're saying to me is that, you couldn't really tell the difference between the vaccine and your normal aches and pains? Is that what you're saying?
That's exactly what I'm saying. That's what happened.
Oh, so I wasn't going to say that. I wasn't saying that. You just said that, yeah. It was, and you're right. I mean, I think what are the actual side effects? So me, I had, like I said, nothing from the first one. The second one, I had a sore arm and I slept. And the funny thing is, I went in the afternoon, and when I got home, I went to bed. And when I woke up, it was dark outside. And I'm like, what? What happened? It was a real deep sleep. But, some chills, but that's it. So let's see what the CDC says about common side effects related to the vaccine. So I think we named a lot of them. One is pain at the injection site. So wherever you got the shot, you had or you could have pain, redness, and swelling. Moreover, over your whole body, you can have tiredness, which is what I had. I had that brief, stint with a coma, headache. You talked about muscle aches, and then I had the chills and the fever, and then I think some people had nausea. These are symptoms that are common, not inclusive, but common. And again, I use this word transient. They come and they go. For me, it was like a half a day, a couple of hours. For you,
about 24 hours.
24 hours. So again, that shouldn't scare you. Don't listen to the horror stories. Kind of move past that and get down to the facts.
Everybody's different.
Everybody is different. That's absolutely right.
Well, I still have questions about the vaccines. I heard that someone got COVID after they had the vaccine. The story was in the Washington Post back in in April.
Okay.
It was a pediatrician from Tampa, Robin Hauser, and what separates her from everyone else is that she came down with COVID after 7 weeks after she took her second Pfizer injection.
Okay. So actually, I think I remember that story myself. And, let me just respond first of all that neither or none of the vaccines said they would be 100% effective.
That's right.
So let's start right there. And the second thing is this story actually, what I recall of it, it's actually interesting. Let's use this as sort of a springboard to move through the vaccines themselves. So if I'm not mistaken, you said she received the Pfizer vaccine?
Right.
All right. So the Pfizer vaccine, my understanding of the Pfizer vaccine and the research says it is 95% effective. Okay.
Correct.
So number two, you said that she had the second dose.
Right.
And so it's one of those vaccines that you need to have the first dose and second dose. I think from the Pfizer standpoint, you have the first dose, 21 days later you get the second
Correct.
one, right? And then you're considered fully vaccinated after both doses and 21 days. You said she had 7 weeks between,
Yes.
yeah. So you know what I deduced from that? She was part of that 5% that would get
Yeah.
COVID despite
Right.
having the vaccine. Again, it's not 100% effective, but
Right.
it is 95% effective. And what they also targeted, or what they wanted to emphasize, is that if you get the vaccines, the symptoms, or the COVID symptoms, have lessened, or they're weakened, or they're not as
Not as virulent.
yeah, not as virulent. Yeah. And second is that you don't have hospitalization, and then ultimately you don't die.
Yeah.
So that's actually the great thing about that. Well, while we're here, let's talk about the rest of the vaccines. Is that a good point?
Yeah, yeah, definitely.
So we talked about Pfizer. The second vaccine is Moderna. And Moderna is 94.1% effective for those who've never had the COVID infection before. It's a two-dose or two injection vaccine, and here it's 28 days after the Moderna. So you take one, and then 28 days you take the second one. And then again, you have the 2-week window after the second dose, and then you're considered fully vaccinated. And then the other one, which I guess is the most controversial of the three, which is the Johnson & Johnson. Have you heard about that?
Yep.
Yeah. So that is actually 86% effective in preventing COVID for those who have not had the disease before. And then it's 2 weeks after that injection, you are fully vaccinated. Why they wanted to kind of make the Johnson & Johnson the most important one, it was just one injection.
Right.
And actually, I had a client of mine who said they had the Johnson & Johnson. It was a man. And so let me tell you about the controversy about Johnson & Johnson. Women between the age of 18 and 49 developed a side effect. It was called thrombosis, or a blood clot. And again, it was unfortunate, but it was only a small portion. So when I looked at the data, it said like 7 out of 1 million would have that side effect, and it's only women. So I don't want to minimize that, but I do want to bring it forward that they had the blood clot.
But the great thing about that is that nobody died.
That's the point. So when we look at these vaccines, here's another point I just want to bring forth. All medications have side effects. Motrin has side effects.
Yep.
Tylenol has side effects, So I mean, why wouldn't we think that these vaccines would not have side effects? And I think the great point is no one died. I almost forgot. What about our kids and vaccines? So they are introducing the vaccines to our children, and they started with the adults, and that was well underway, and now our children are up, for discussion and taking the vaccine 12 and up. And anytime we start talking about our children in our community, that's a sensitive subject.
It is a sensitive subject, but we have to talk about it now that they're out for summer vacation. But not only the children, we have to think about the teachers who are preparing for them to return. My daughter is an educator, and I worry about her. I worry about my grandchildren too, but these are the things that, we got to think about. Now is the time.
Let me say something while we're on the topic of children and school. We actually just say, children and teachers. Do you know there are other people in the school system that we need to be concerned about? So let's name a couple. What about the bus driver, the people that drive the bus, the transporters? Yeah. What about the what do you call it? Teachers' assistants or teachers' aide? They're in the school too. Yeah. What about the janitor in there? And for God's sake, don't forget the lunch lady, the one who makes the tater tots. we got to protect her at all costs. And so that's. I mean, let's think about it from a bigger perspective. It's not just those individuals. It's everybody who comes in contact with our kids. So the vaccines are available for them as well. So
were you gonna bring up about the heart inflammation with the vaccines for the kids?
Well, yeah, I guess not. So now you're talking about something a little bit more solemn, So I'll stop laughing, So I know originally the thought was we wanted to get adults vaccinated and get the economy, back open and help things move forward. And so we're doing well with that, and now they're looking at the kids, mainly those 12 and up, and early research is very promising regarding the vaccines, and our children. However, in the spirit of transparency, there is a side effect, just like there was one with Johnson & Johnson, there is one for our children. And that side effect was the inflammation or, irritation of heart tissue for our children. Again, it was between a small segment. It was those ages 16 and 24. The reason that caught my attention because the NFL draft and we were talking about the vaccine for the people who came out on the draft. And the second piece I want to say is just a small segment. So out of 1 million, the CDC said it was like 200 individuals. So and like you said before, April, no one died. Not to minimize the side effect, but no one died, to my knowledge, to date. And it's a transient, again, that word, side effect, meaning it will go away. And again, I want to use a phrase that I use quite often when I'm prescribing medication, and that is the benefit outweighs the risk. Here again, now you have a benefit, you won't die, and the risk is you might have a side effect. So I just want to bring that to the
table. Yeah. Mm-hmm.
Well, I hear what you're saying about the benefit outweighing the risk, but I still have a question. If this vaccine is safe for everybody, people with the comorbidities.
What do you mean by comorbidity?
High blood pressure, diabetes, heart disease, MS. Is it safe for them also?
So, I read an article by the WHO, the World Health Organization. They published it in, I think, January the 29th, this year, January the 29th. And I guess a direct response to your question, yes, it is safe. they're saying that individuals who have medical conditions that are high risk with hypertension, diabetes, they also talk about asthma, people who have,
Right.
asthma or pulmonary disease, liver and kidney disease. It's safe for them to take the vaccine. The other thing they talked about is people who have chronic infections and that they're stable, they should take the vaccine. The one caveat, the one point that I want to kind of emphasize in the article was people who have who are immunocompromised should be given education, counseling, and then be encouraged to take the vaccine. Those would be those people who are like people who have HIV and that
They're immunocompromised.
that's right. Those individuals, and they're saying, hey, you need to educate them, counsel them, answer any questions they may have, and then encourage them to take the vaccine.
What about pregnant women?
Yeah, and that's actually in that same article. You're right. That's a good point. In that same article, they actually encourage pregnant women to be counseled, educated, and then given the vaccine. One other point, which we don't want to forget, certainly as healthcare providers and anyone, once you have the baby, and there are some women who choose to breastfeed, they still can receive the vaccine, and it's safe. Anything the mother gets, the baby gets through the breast milk, but vaccine is still safe. So I think that's it. So I got a question. Oh, and one more thing before I jump to my question. This is important. You're hearing a lot on the news about the Delta variant. You remember that? Have
Right.
you heard that? I mean, it started with,
India.
yeah, it started in India. You're right. It started with the one that came from the UK. Now it's the newest one is originated in India, the Delta. The vaccines, if you're taking the vaccines, they help mitigate any sickness that you can have with the Delta variant or any other variant. So it is good that you take the vaccine. It's good for our community to consider taking the vaccine. So anything that's coming down the pike, like the Delta variant, you have some
You're
protection.
covered,
against
yeah.
it. That's it.
Mm-hmm.
All right. So how do you get more information about vaccines? I think we covered a lot. We talked about a lot, but how do you get more relevant and truthful information about the vaccines?
Well, you do have to do the work. You do have to do the research. And you need to research from a legitimate site like the Ohio Department of Health, or like you said, the WHO, the World Organization Health Organization.
Mm-hmm.
Mm-hmm.
Well, don't forget you can use your own healthcare providers, your doctor, your nurse practitioner, your PA, your pharmacist. They're all there to help. They have places that you can go to ask about that.
And where can you go and get the vaccine? I think we talked about how you get the information. I think we better talk about where, if you want to roll up your sleeve and you're so inclined, where would you go?
Any Walgreens.
Yeah, pharmacies, all the pharmacies, CVS, Rite Aid, and Metro, they give out the vaccine as well.
Yeah. So I could talk all day about the vaccines and COVID. I'm kind of a geek in that way, but I think we want to come to a close on this part of it. But before we leave this topic, I want to do this exercise I do often with some people that I'm educating, like my students. If you had more time, what would be one thing that you would cover regarding the vaccines?
Oh, I think I would cover long haulers. The long haulers are people who have long term symptoms from the COVID-19 after recovering from the acute disease. Yeah, they're still doing research on how long haulers respond to it. And I've heard that many of the people who had the long hauler disease have had their symptoms diminished or eliminated by taking the vaccine.
Actually, I read that research, and the first time I heard about that, it was a person on CNN who had it, and then he talked about that. So that's you're right. The long haulers, and I really certainly would encourage vaccine compliance with that.
Well, I would have covered more about the home test, how we could get that in the hands of more people, make it a common thing that you have the test there for screening. If people have symptoms, they would have it there and they could check to see if their symptoms are from COVID, and then they can go from there to see if they need to go see their healthcare provider.
Okay. And if you ask me, I would like to come up with a way to enlist influential people in the community to help push vaccine compliance and break down the hesitancy. Do you all recall when the vice president and the president, got on TV and they pulled up their sleeve and they got the injection? I think that's powerful, but I think we need to look at it like who is influential in our community, and then who would influence people to be compliant with the vaccines. I have some ideas, but I won't name anyone. I know we have commercials now, and they're targeting our community. The people on the commercials look like us, but I think there's some influential people that could help us in that area too. We want to talk about care disparity. This is another one. If we don't, do enough, commercials towards our community. The other thing I want to talk about is maybe have the vaccines offered in places that we frequent. So, every 2 weeks I go to the barber shop, and they move my one strand of hair from one side to the other. That might be a place where they would, you also want to set up a vaccination site. And for women, they spend hours in
the salon.
The salons.
Uh-huh.
Yeah, put them in there. That might be, it might be a good place to kind of catch, an audience. So I know we ran over our time, and we will cover or recover it on the other side in our next presentation. In closing, I want to once again thank each of you all for participating in this discussion, and for the community and for listening to this dialogue. We hope we provided some additional enlightenment and information regarding COVID and vaccines. Once again, we want to thank St. Timothy Missionary Baptist Church and the Ohio Department of Mental Health and Addiction Services, and certainly for our Ascension group that selected us to host this event. I don't know about you, this 30 minutes went by fast. This presentation will be aired on several platforms. It will be streamed by St. Timothy Missionary Baptist Church on Facebook on July the 6th from 7 to 8 p.m. and again on July the 13th from 7 to 8 p.m. Again, that's on Facebook. And then the Ascension group will host a Zoom offering on June the 29th at 7 to 8 p.m. and again on July the 10th at 11 to 12 noon. For the Zoom offering, we'll host a Q&A, question and answer, on those dates. So look to avail yourself of those dates. Also, I want to put a shameless plug in for several other offerings. We're going to address the opiate crises and treatment options. Believe it or not, during this pandemic, that has really kind of become a big problem. It was already a problem in our
Right,
community. The cases have risen. So we want to, talk about that. It'll be a 2 hour or an hour event, two offerings, and it'll be much like this, and they'll occur in the month of July and the first week of August. And then there is another offering I want you to put on your radar. It's talking about available resources in Cleveland for those who are struggling with opiate addiction. I know people who are struggling with the disease, but they don't know where to go and get treatment. So that will be coming. It's an hour offering. It will be hosted by a case manager and someone who's struggling with the disease process itself. So look for that to be aired at the end of July, the beginning of August as well. So stay tuned. You have the dates, the platforms, and we thank you for your most valuable commodity. You know what that is?
Your time.
Your time. Thank you. So I would like to thank everyone for joining us in this recording today as we engage in a discussion regarding COVID-19, specifically COVID testing. This is part 2 of a 2-part series. Again, I do not believe that any true discussion can be had without some learning, sharing of information, thoughts, ideas, and having an appreciation for a person's perspective regarding the subject matter. Meaning everyone will have an opinion on COVID and testing. We want to hear those perspectives. We encourage those perspectives, but we want to be respectful in our exchange. There's many opinions about testing, but there's only one truth, and that's our pursuit today. Let's take care of some housekeeping items before we jump into the discussion. This presentation is being presented or hosted by St. Timothy Missionary Baptist Church of Cleveland, Ohio. I'm proud that the body of Christ has thrown its hat in the ring to ensure the community has access to relevant information regarding COVID and COVID testing. This is a faith-based initiative with underwriting by the Ohio Department of Mental Health and Addiction Services. By way of introduction, I am Jeffrey Sims. I'm a psychiatric nurse practitioner specializing in adult psychiatry and treating those who struggle with addiction. I have to my far right Cheryl Billingsley. She's a registered nurse and she served in the past as a physician assistant. To my immediate right, then there's April Holloway. Mm-hmm. She is a respiratory therapist. We serve as clinical consultants for the Ascension Group and LLC of Cleveland, Ohio. So I think we've done away with the preliminary stuff. Let's jump right into some questions. And here's a hot piece of cornbread coming out the oven. So we have millions of people vaccinated and 3 vaccines that have been highly touted and successful. So why are they still pushing us to get COVID tests? I don't understand it.
That's a good question. And anytime someone is trying to force our community, the African American community, to do anything medical, they resist. We resist. Mm-hmm. But the real reason for testing is people are still getting COVID, going to the hospital, and still dying. And the reason you test is to save lives and to stop the spread.
I'm glad you caught yourself for saying they and not say we. so I'm glad you said that.
I'm native.
Mm-hmm. But the real question is deeper than testing. Even before we get to testing, we must get them out of the mindset that COVID isn't real. And then, and only then, can you move to the discussion on testing and testing our community. That is the word I hear in many neighborhoods. How do you fight that?
Wow. So, I mean, you've taken it kind of a little deeper than just testing, but my experience with fighting disbelief is you have to be patient, consistent, and arm the individuals with information, with facts. Now, here is an example, and this is going to be a far stretch, so you're going to have to follow me. It's like that. What's that? That Picture It, Sicily. with the Golden Girls.
Oh.
I'm a big football fan. And I consider myself a football genius, just so you know. That's the word on the street.
Whose
and,
street?
and I view the NFL as a reflection of our society, not economically, but diversity-wise. So economically, you have players who are making millions and millions of dollars, but the diversity, you have African Americans, you have Caucasians, you have Latinos, and you have Asians. And this group, the NFL, they're struggling with accepting COVID as a disease just like we are. They're struggling with testing just like we are. And heck, I just saw this one player announce nationally that before they take a vaccine, that they would walk away from their career, meaning walk away from millions of dollars. So they are having they need to make decisions just like we, big decisions about their lives, livelihood, children and careers. So here's the catch. And y'all missed the joke, the pun, the
Yes.
catch, football. Yeah. If they don't take the vaccine, they have to be tested daily, separated from other players who are vaccinated and wear a mask. I was just reading it and I pulled it up. I found my report from the NFL, and here's what they're saying for players in the preseason. For not fully vaccinated players, so that means those who only taken one dose of the Pfizer, or one dose of the Moderna, or no vaccine at all, they have to be tested daily. They have to wear masks at the facility where they're at. They must physically distance themselves from others in the facility. They have to quarantine themselves after high-risk exposure to COVID. They have travel restrictions. They are not able to physically sit in the cafeteria. They must distance themselves from other people. And coaches who don't take the vaccine, they have to grab their food and go. They're not allowed to use the sauna or the steam rooms. And then when they travel, they're not able to leave the hotel to eat in restaurants. They may not interact with anyone outside of the team. So that's the restriction for those in the NFL.
That's just like us.
You're correct. So that's exactly what I was pointing out. So the CDC says if you're not vaccinated and if you're or partially vaccinated, you need to wear a mask. And I want to say this one thing about the mask. It needs to cover your nose and your mouth. It can't just be on your chin or in your ear. You have to stay 6 feet apart from others who do not live with you. You need to avoid crowds and poorly ventilated indoor spaces. And you need to wash your hands with good old soap and water, hand sanitizer, if soap and water are not available.
I thought Cleveland dropped that mask mandate.
Well, it wasn't Cleveland. It was actually Ohio. And the governor in June, I think it was June the 2nd, dropped the mandatory mask mandate and the social distancing. But here's the trick. Here's the rub. It's only for those who are fully vaccinated. So I mean, it's still there. You have to be mindful of it.
So tell me about your experience with being tested. You were tested, right?
Okay, well that's a good pivot, but okay, jump right to it. Well, I have one word about testing, and it's not to frighten people. It was painful for me. So unfortunately, I was exposed at work. I was exposed by a coworker, and I was given the option of quarantining or being tested. And this was at the height of the pandemic, and so it was like when they had just closed down, the hospital, well, the hospital, but businesses, and people were kind of dying from COVID at rapid rates. So I decided to get tested, and so they tested me the same day. It was kind of, I don't want to say traumatic, but I'll say traumatic, because I drove up to the hospital. I won't name the hospital. And I went to get out of my car, and they closed the door. I almost, caught my leg in the door. I'm like, whoa. They stay in your car. Don't come out. And I'm like, okay. And then the person came out, suited and booted. I mean, they were like in the hazmat suit, and they came out, and I'm like, okay. And then it was a woman, and she said, roll down your window, and that, so she didn't say anything because you couldn't hear her, and she just, kind of mimed the whole thing.
Yeah, gesture.
And then she said, hold on to your steering wheel. And then it tilts your head back. Well, right there, that tells you right there that things are not going to work out well on your behalf. So she then inserted the nasal swab, and I'm just saying, I think she took some of my brain matter. I need every piece that I have, and thank God she didn't ask to do both sides. It was just one nostril, and that was my experience, and it was painful for me. That was just mine. And again, I don't want to scare anyone, but that was my experience. I don't know who else was tested.
I was tested.
Okay.
But, I had some discomfort, but it wasn't like giving birth pain.
You sure?
Yeah, I'm sure.
Okay.
Yeah, but I had discomfort, and it lasted. My nasal passages were sore for a day or two, but it was just uncomfortable.
Did you do it, or did someone else do it?
I had a home testing.
Oh, so you were
Yeah,
okay.
yeah.
You were, I guess that makes a difference too.
Yeah, but they tell you how far to go and stuff like that. And I had some bleeding, but
well, that's not a good sign. But let me let me say something else, because although the testing was painful, I want to talk about the mental health side of this. You know what was also kind of unsettling? Waiting for the test.
the results.
So the anxiety waiting for the test results was something else. So it came back that same day. Mm-hmm. So listen to how we kind of move through life, our community. So I got tested, and then what did I do? I went back to work. So at work, I'm kind of, my thoughts are kind of half and half, am I okay? Because think about what could have been on the other side of that. And so as I'm trying to, provide comfort and care and whatever to others, I'm worried about, am I going to live? Am I going to go be hospitalized? What I'm going to do, for my family? So the anxiety was really real as well. So, but again, what was great, I had the pain, I had the anxiety, I made it, and I was negative. So that's my story.
How many times were you tested?
Say that again.
Oh, I mean, not how many times were you tested. How many times did you get tested?
Yeah, once. So let me tell you that was so painful that I ran to the vaccine site with both sleeves, kind of raised. Like I was okay with getting vaccine after that. It was, for me, again, it was painful. So I had one test and then the vaccine, and I'm good to go. So.
Well, you can still get tested after you've had the vaccine.
Yeah, that's an important point to make, Cheryl. So like my aunt, we were kind of vaccinated at the same time. She's like 84, 85, and we were vaccinated at the same time just recently. So it was in February, March. Recently she became ill, and she had some of the symptoms, the COVID symptoms, the chills, the sore throat, those kind of things. And so she went to the hospital, and they tested her, and thank God she was negative. But yeah, it's still, it's still appropriate, still indicated if you have some of the symptoms.
So I'm backtracking. So if testing is so painful, why would the NFL choose to get tested every day?
Well, so now that this is going to be aired, I'm going to say that I will dare not speak for a billion-dollar industry like the NFL, but what I will talk about it from a kind of more macro perspective. From any organization, you want to prevent the spread of COVID. If you're not fully vaccinated, or if you're not vaccinated at all, you can still spread the disease. So that's why I think any organization would really kind of encourage people to still get tested, because COVID is still out there and people are still, as Cheryl has said before, dying from it. So Cheryl, what are some of the facts we need to know about COVID testing?
Well, basically, there are 3 tests: the antigen test, the antibody test, and the home test kit. The antigen test is the gold standard. These are taken by the nasal swab.
The one I had.
And the one I
It
had.
almost took me out of here.
It's rapid, it's inexpensive, and you get the results in about 20 minutes. And it detects if you have COVID virus currently. Then there's the antibody test, and it doesn't diagnose if you have it currently, but if you've had the COVID virus in the past. And then the home test kit is basically self-explanatory. You take the test at home. You can swab yourself at home and process it at home, or you could swab yourself at home and take it to a laboratory where they can process it there. Now,
Now, tell me, why is there a need for me to get tested?
there are a few reasons why you should get tested, and that is if you've been in close contact with someone who's been diagnosed with COVID, or if you're in a high-risk situation such as traveling, or you work in a place, work or live in a place where you're in close contact with someone who has COVID, like if you're working in a hospital or nursing home, your patients have COVID, or if you work in a prison or a homeless shelter, you're in close contact with someone who has COVID. And then you could be scheduled for surgery or medical procedure, and you need the test to clear you for surgery. And some employers or schools require that you have a negative COVID test to clear you to come on board. And then you may be starting a new medication that affects your immune system, and they want to know that you don't have COVID before you start the medication.
Okay. So tell me, where are some of these places that I can get the test kits, preferably free?
Okay. They have free home tests at various local libraries, and you can get these tests. You just go and ask for free home test kits, and they have online apps with the kits, and they just walk you through the test, and you can download your results and show your employer or whoever that you've taken the test and that your results are negative or positive, whatever they may be. Then you can Google free COVID test distribution sites, and it will come up and show you where the tests are given away. Now I'm pivoting to a different subject. The most local pharmacies have taken over the testing and even the vaccines. So you can go and purchase tests at the pharmacies or your local department stores, and you can also get your vaccine there. You might need to call your pharmacy to see if you need to schedule an appointment. Sometimes they do have the drive-through where you can just get it driving through, and you don't have to get out of your car. And then there are some pop-up sites that advertise every now and then that they're testing at this site. So I have a free COVID test that I got at a library. I don't know if you can see it, but this is what they give out, and you just ask for it. You can get more than one at a time.
Oh, really?
So now more information about the test. You can go to coronavirus.ohio.gov and they will give you more information. Now the CDC has information on testing, such as who should get the test, where to get the test or get tested, and what you should do once you get the test results.
So I think we're kind of at the end. We hit our point. I would like to thank everyone for participating, and we talked about the times these will be aired. It'll be July the 6th and the 13th by St. Timothy Missionary Baptist Church from 7 to 8 p.m. and by the Ascension Group Zoom offering on the 29th and July the 10th. We thank you for your most valuable commodity, time.
Your time.